Ladies and gentlemen, the opioid plague has actually gotten worse during the pandemic. It never did get better, it got worse. And, this was one of the promises that Trump made back in 2016 that he would get rid of the opioid plague. And shoot, you can't even get this man to talk about opioids anymore. I can't even remember the last time he even publicly spoke about this. And remember, he appointed Kellyanne Conway, who's no longer part of the administration, to head the opioid crisis. So, I mean, who's leading it now? You hear absolutely nothing. So this came out in the AP October 21st, 2020. Like millions of Americans, Diane Urban watched her first presidential debate a month at home with her family. When it was over, she turned off the television and climbed into bed with her 25-year-old son, Jordan, um, who used to sleep in. That was where she found Jordan's lifeless body after he overdosed on opioid fentanyl one morning in April 2019. So I guess that's the picture she holds of her son. After watching President Donald Trump target the son of former Vice President Joe Biden for his history of substance abuse, Urban was reminded again of the shame her son lived in during his own battle with addiction. I just think that Trump doesn't understand addiction, said Urban, 53, a Republican from Ohio who voted for the president in 2016. The exchange over Hunter Biden's struggle with addiction was brief, and neither candidate was asked a follow up question about their plan to tackle the nation's drug addiction and overdose crisis because they're not going to do anything. Opioids, what, 22 years in the making for this addiction? It's not going anywhere. And as COVID continues to overshadow everything else, I doubt if it will come up anytime soon. The issue has barely registered this year's presidential campaign, overshadowed by human and economic toll of the coronavirus outbreak and the Trump administration's response to the pandemic. Yet drug addiction continues its grim march across the U.S., having contributed to deaths of more than 470,000 Americans over the past 2 decades. And it's only getting worse. After a 1-year drop in 2018, U.S. opioid overdose deaths increased in 2019, topping 50,000 for the first time. According to provisional data from the U.S. Center for Disease Control and Prevention. And remember, they only get data, I think, from 22 states. It's not all 50 states. So that number is always going to be an undercount. That accounted for the majority of the 71,000 fatal overdoses from all drugs. While national data isn't available for most of 2020, the Associated Press surveyed individual states that are reporting overdoses, found more than drug-related deaths amid the coronavirus pandemic. Ohio, a battleground state in the presidential contest, is on track to having one of its deadliest year of opioid drug overdoses. So 2020 has been a very deadly year in Ohio. But see, Ohio, even a few years back, was one of those states that was really bad, even prior to the pandemic. More residents died of overdoses in May than in any month in at least 14 years, according to preliminary mortality statistics from the state health department. As Trump nears the end of his first term, some supporters, including Urban, feel left behind by his administrative policies. Well, he can't focus on he's not going to focus on this, especially as long as COVID is going strong in the country. He's not going to pay attention to drug addiction. During Trump's first 2 years in office, 48 of the 59 Ohio counties with reliable data saw their overdose rates get worse, according to an analysis of CDC data by the Associated Press. The data was compared to overdose death rates in 2015 and 2016, the last 2 years of the Obama administration. What that looked like on the ground is mothers donating to GoFundMe accounts and Facebook campaigns so other parents can bury children who've overdosed. Some parents even reserve a casket while their child is alive so they are prepared for what they believe is inevitable. Others become legal guardians of their grandchildren, among them Brenda Stewart, 62, and her husband, who adopted their grandchildren a decade ago as their son struggled with addiction. That led Stewart to start the Addicts Parents United, a non-political support group for parents with children with the disease or who have lost a child to it. She said what we saw during the debate was two people yelling at each other instead of substantive policy discussion she believes deserves to be heard. So, she's like many people that have, children that are addicted to drugs, and they just feel like, everything going on has overshadowed this, although in the background, they are still dying, ladies and gentlemen, by the thousands every single week in America. And is not getting any attention, and I don't believe it's ever going to get a lot of attention anytime soon. And I also don't believe they're going to fund this as long as, economically, there's a lot going on in the country, including, there's still talk of the stimulus and doing something about unemployment. And we know there's not enough jobs out here for everybody. So as long as those things are on the agenda, unfortunately, this opioid plague is going to be thrown on the back burner. Okay, so at times Trump has spoken sympathetically about addiction. And, he did talk about it here and there. And I can't even say that even when he first took office, he talked about it a lot. He really didn't. He really didn't. I mean, it might have been a handful of times we heard him mention opioids, and then he came up with that task force, and we may have heard it a time or two more, and that was it. Haven't heard another peep out of it. And if you remember, they wanted him to make this a national emergency, and he would only make it a public health emergency, and there was no funding. And that was one of the biggest complaints that people had. See, if it was a national emergency, then it would have been a substantial amount of funding going towards the addiction. And he shut that down. He didn't want all that money going towards addiction. He didn't want that. But with a shortage of medical professionals, states have not been able to spend their entire allocations, and some worry that grants lasting just a year or two will not be sustainable. The Trump administration continues to advance federal funding for opioid response efforts, requesting 1.5 billion more for state grants in the current fiscal year and prioritizing prevention, education, treatment, and law enforcement efforts, his campaign said in a statement to the AP. Okay. Those involved in addiction treatment and government response say Trump's approach has been inconsistent and lack sustained attention. For example, his policies ease access to drugs that are meant to control opioid addiction, especially for people receiving health coverage through Medicaid. But he also has aligned with Republican lawmakers and Attorney General in trying to repeal President Barack Obama's Affordable Cares Act, which allows states to make more people eligible for the program. Trump also has repeatedly tried to slash the budget of the Drug Control Policy Office, which is intended to set policy for a drug response that is carried out largely by law enforcement and health agencies. Congress has so far maintained the office funding. Patrick Kennedy, a Democrat former member of Congress appointed to the bipartisan commission Trump formed to address the opioid plague, said the president started in the right direction, but did not show up at any of the commission meetings or follow up sufficiently. So he didn't even care. So they had meetings and he never even inquired about what went on at the meetings, what was discussed. So he didn't care. You know what? He did all of that for show. He had to make it look like he was doing something about opioids. Trump, for all of the enormous faults, could have really made this a defining achievement of his presidency, Kennedy said. I really, in all honesty, y'all, I don't think Trump cares about these drug addicts out here. He is so far removed from that kind of stuff, it's not even funny. But now, if you didn't know, you know now. He's not going to put a lot of emphasis or focus on drug addiction, and the country is damn near collapsed economically. I mean, this economy is nothing like it was before a year ago. And you know, Trump is about his money. And what has he really been talking about? Reopening, reopening. You know, that's all he's focused on. He's not going to turn and look at these drug addicts. You know why? Because there's no money in it. You're pouring money to help drug addicts, but you get very little out of it. He doesn't want to spend time on it at all. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.